geek into the research. And so I did that a little bit and kind of tapped into our whys of why we want to know these things and why we need to think about them, though, especially as family members, we look up and go, when am I going to think about this? When am I going to have time for this? So I appreciate you coming today. If you guys would do me a favor and throw into the chat, I'm going to do that this morning because I'm feeling like I want to connect. Where you're from, and kind of what you know about charting, not what you know. Are you feeling like you're really familiar with charting a life course? Are you a newbie? And what's your role? Are you a parent? Are you a professional? In what capacity are you a professional? And just let me know about you a little bit. And I'm going to hang so I can see. It'll get me going and make me more connected, which always makes me a better presenter. Hi, Autumn. Thanks for coming and thanks for typing in the chat. I appreciate you. Morgan County. Okay. Franklin County, I think, is the FC, right, Micah? Hi, Lisa. Good to see you. Oh, a newer SSA service coordinator, Crawford County, SSA. Now, if you guys are family members, put that in there. I don't want you to feel, because you're seeing all those professionals, I don't want you to feel like you're in the wrong room, because the whole thing that has brought me to this work is that I'm a family member, and that several of these professionals that I'm seeing in the room are family members too. Oh, hello. Wait a minute. I'm going to go back. Hi, Maureen. Nice to meet you. Cleveland, Cuyahoga County. All right. Thank you so much, you guys. It just makes me feel a little more connected. Hi, Connie. Goodness gracious, long time no see. How fun. Okay. All right. You put me in my happy place. It no longer feels like Monday. So I work at the University of Cincinnati, you said, and it sits down here at Children's Hospital, but I have the privilege of working with Erica and Tracy and Barb through the Family Resource Network of Ohio. I support families from birth into aging and any family member. So I just walk alongside because I too am a family member and have been on an interesting journey that changes and continues to change. So this slide is my why. When I tapped in and said we kind of need to know our why we came into this room, who we're thinking about most, because some of us wear two hats. Are you here because you're thinking about the people you serve? Are you here because you're thinking about your own family? But this is a series of pictures. In the upper left is me with my oldest sister. To the right is my niece, Grace. Down here are my 4 kids, and my oldest, I think I've shared in this room, and she's in the field and is open with me sharing that she is a newer diagnosed. She wasn't diagnosed until adulthood as an adult with autism. We always knew there was something going on, but she was at the early stages of us knowing about autism and girls. And so she kind of got missed. And then my sister-in-law is that last picture, Kim, and Kim is my husband's middle sibling. As I mentioned, I can't do this work without Tracy and without Erica. They make us look like we know what we're doing. You know that all of this work, if you're familiar, comes out of the Family Resource Network of Ohio and is supported not only by the Department of Developmental Disabilities, which is the focus of this particular event, but also the Ohio Department of Education. We've been doing some amazing work with these 2 entities, and really, I want y'all to know, and I'm going to say to the family members in the room, the focus is on getting this in the hands of families so they can use it with the professionals in the room, and that you guys have a shared language. So we're really trying to bridge that gap. This work has come out of the University of Missouri, Kansas City LifeCourse Nexus. And we are now working and supported within a national community of practice of over 22 states. So there you have the big important stuff that we need to share. And we thank all our funders and the folks that are making this work possible. This was one of the first things I was exposed to when I stepped into this role. And I love that it is a good chunk of what I'm doing because I think this work is super important. Not many folks said how familiar they were with charting a life course, but I'm going to tap into just the primary 8 principles for those of you that may know it, but don't feel really deep about it, just so you have a little bit more information as we talk about some of these things. So the Charting Life Course has 8 guiding principles. The tools that everybody is familiar with Charting a Life Course come out of those principles. They came out of large stakeholder conversations about some different things. And out of that came these tools of how do we get this information, because we need to have it to support families, but how do we make it easy for individuals with disability and families to share this information with all the people that they have to be in rooms with. So So first and foremost, Charting the Life Course talks about all people. All people have the right. And that really means that we're looking at the all of disability, some connected to systems. That tiny green part of the triangle there represents those that are affiliated and connected to systems, and that purple, much larger, 75% represents those families that are not connected to systems. That's my family. We didn't have access to systems or systems to support across my daughter's lifespan. Whoops. So that's kind of what that represents. This symbol here, the family systems and cycles, reminds us that we are always person-centered with Charting the Life Course, but we always understand that that person has to be viewed within the context of their family and how they engage with their family. And that family is defined or by that person, not necessarily blood related, not all the systemy things that we require that says your family or used to. We're leaning into this broader view of what I call my village, right? And then we are looking across the lifespan, and we really look at that trajectory, that upward movement of trying to have that life that we really want. And then those life outcomes, those things that we want to see in our lives, where we're connected to others, that we have the supports we need across all life course domains. The domains are those areas of life that we talk about, healthy living, daily life and employment, safety and security, advocacy and engagement, and community life. And last but not least, eligibility. But we always save that one for last because we really think of it as a place to support up all those others. So the 3 buckets of support is a space that I adore, and it was what really stood out to me the first time I ever saw Charting the Life Course. And that's the idea that goods and services is a very important bucket when supporting families with children with disabilities or with family members with disabilities. But there are 2 other spaces where we can feel supported and that we are at capacity. That is the information and networking, the information and discovery bucket, and then the networking and connection bucket, that space where we get information that we need to do the work that we need to do to support our loved one. And that middle one is how do we connect to people that have been on that same journey, maybe a few years ahead of us, and have had experiences that can share and that they can understand where we are when we are at a point where we need more information. The integrated support star, which is that place of how do we really get support and how do we look beyond eligibility. And then lastly, that policy and systems, that way of this is all well and good, and this is how families need to be supported. And yes, we're looking beyond eligibility, but how do we change policy and procedures in order to have our systems that support families do a more appropriate job, a better job of really truly supporting them in the way that they need to be supported. So this conversations that we have in these trainings, when we do one-to-one with families, when we integrate Charting the Life Course into procedures, it really is to inform systems so that they can pivot and better support families. That's the ultimate game. So I mentioned before, all people. This is the core belief of Charting the Life Course. All people and their families have a right to live, love, work, play, and pursue their life aspirations in their community. And that's really about all of us living the life we want to live with the people we want to spend time with in the communities that we want to be part of, and really supporting it from that space. Home and community-based rule is kind of what drives it in the DODD system. That idea of transitioning students into the community and supporting them across their least restrictive environment into their extracurriculars and community activities. That's where it kind of falls into the support of the education system. In Charting the Life Course, we always have a vision for each of us to be able to create this life across all those domains that I mentioned before, with support where needed. So those supports vary for each of us in each domain. However, we kind of grow our skills and our abilities to support ourselves across time. All of us do that. So many of us may not assume a completely independent role in making our choices or our decisions in every area of life all the time, but likely we take a more interdependent role or approach. So healthy living's no different. I don't make financial decisions alone. I've decided I don't like that. It's not that I can't, I just don't like to. But healthy living is no different. I'm confident in making the most of my day-to-day decisions about my health. But when there are unexpected or more long-term changes in my health status, I may reach out to others and ask for help. It may be a friend or that has had similar experience, or it might be a professional. But let's be honest, though I don't recommend it as a stand-in alone, every once in a while I just use Dr. Google, right? To kind of get a sense of things. So I'm currently trying to manage more healthy habits and eating in my own personal life. And in the beginning, I really needed a whole lot of help from others, reminding me, sharing ideas. And now it's become more of a lifestyle change that I'm kind of managing on my own. And so each of us is managing that journey differently. So you'll take away information today, I hope, that will help you help yourself, but also help you help those that you are thinking about when you come in this room. So let's kind of geek out a little bit for a second. In September of 2023, the National Institute of Health now considers people with disabilities as a population with health disparities. Okay, they finally recognized that was the case. We've kind of probably known that for a while, but it is now official. And we can easily see the importance of the healthy living on our lives when we take the time to look at intersectionality with the social determinants of health. When it comes to health, it matters where people live, where they learn, where they work, where they play, where they age. Conditions in these environments affect a wide range of health, functioning, quality of life, outcomes, and risks. Determinants like economic status, education, access, and quality healthcare access all make a difference. Neighborhoods, social and community relationships, all types of relationships with family, friends, coworkers, and community members. The context of all of that matters and impacts our health. Therefore, poverty, unequal access to healthcare, lack of education, stigma, and racism are all underlying contributing factors to health inequities that have a negative impact on our access to a healthy life. The Centers for Disease Control and Prevention is committed to achieving improvements on people's lives by reducing health inequities. So looking at this graphic, we can see that health is impacted by our opportunities and experience across all domains. So you're looking at those domains down the side, and you're able to see how education impacts it in each space, right? And how economic stability impacts it in each space. So your health can be influenced and determined by opportunities, experiences in daily life and education. So helping individuals to think about and identify their vision in each of these domains is going to impact their health and establish a level of healthy living and quality of life across time. It's not simply about getting a gym membership anymore. So we really have to think about this deeply. So it's really important to think about a few things. It's never too early to start teaching the person that brought you to this room, those that you work with and support, those that you love, about healthy habits, just as simple as eating nutritious food and moving their body. It's just as important to have a team of healthcare professionals that advise and guide you and partner with you to help the folks that you support develop a healthy lifestyle that will last into their future. And things you can think about are like, with younger families, how are people helping the pediatrician that's supporting the family understand and meet that child's needs? Does that pediatrician help refer them to specialists when needed? Or is the family finding or accessing medical and health personnel that are experienced in the type of care that they need for that child, for that particular diagnosis? What do we do if we don't like or disagree with the medical professionals? What therapies or activities help them grow and develop? How are we teaching them about healthy, nutritious food and how their body works? And how are you helping them get plenty of physical activity and exercise? And we all struggle with that, right? So when you look at comprehensive healthcare, and those social determinants of health, comprehensive healthcare means integrated, coordinated care that gets beyond just treating illness or hospitalization. It's how our systems should be operating and thinking now. And it includes connected care between that general practitioner and any specialists, addressing both the physical health and our emotional health for both the patient and the family member. So this model really encompasses preventative and diagnostic care, as well as the management of short-term and chronic illness. Every aspect of this care can be influenced by various factors, such as insurance coverage, cultural beliefs about accepting help or views on disability, spiritual beliefs regarding medical intervention, and basic needs like access to transportation to even go to the doctor. All of these are variables that we have to think about. When we think about long-term healthcare needs, individuals with disabilities and their family requires an understanding that a healthy lifestyle extends beyond medical needs and care. It involves considering the range of services and supports that they need to meet their basic home and personal care requirements. Long-term healthcare needs to go beyond medical care to include assistance with daily personal tasks, or ensuring that an individual can express or advocate for their wants in care, express how they want to accommodate their needs in day-to-day things, and ultimately to get the help they need to maintain what we know is a more healthy lifestyle for them. Lastly, we have to look at that idea of wellness and consideration of both proactive and holistic approach to maintaining our overall well-being, right? It requires improving someone's overall feeling and sense of life, their problem solving, their planning, and really focusing on those preventative measures and lifestyle choices that promote not only physical, but mental and emotional health. For someone to have access to those most positive outcomes. Without considering all of those, we are reducing the probability of them accessing good outcomes. And as we said earlier, that access to impacts, that the access that's impacted by those social determinants of health are going to have an influence on that. So we need to consider if we want to support someone to have their most healthy life, we have to recognize the things that were brought up by that National Institute of Health, and look, among other things, at how we encourage more research into the impact of those health disparities on individuals with disabilities and their families. And that is part of the work of the USAIDs like NYSONGR and the University of Cincinnati. So these discussions clearly show how interconnected the Charting LifeCourse domains, especially when we see it through the lens of healthy living, how impactful they are. So that intentional and planned conversation with families and the professionals that work with them, and even the school teams or the disability support teams, that really everybody has to have a shared broad vision for health, healthy living, and healthcare for those people with disabilities and their families to really access those outcomes. Any issues or surprises in any one of these areas can slow the progress or change the direction of our goals and vision across any of the other ones, and impact that vision we have for an overall great life. Purposeful planning and problem solving is really vital in achieving and maintaining a healthy and fulfilling quality of life for the people that we care about with disability. And so this is why, when I said at the very beginning, it's work that we often find ourselves not having time for or having trouble fitting in amongst all the other priorities in life. But it has such a great impact across time for the folks that we love as family members, that having that shared language and that shared vision across all these systems in this particular domain is really important. One of the tools I really love for kind of looking at this and breaking it down and not having that overwhelmed feeling of, oh my gosh, are these LifeCourse, Training LifeCourse quick guide tools, because they really highlight and help you think about how the life experiences for the person you're supporting is having in the stage that they're currently in. It can support them and those they care about to really think about being ready for the next stage too. So it allows them to anticipate what they can or should be thinking about in the future. And it gives that perspective always of those higher expectations and creating a mindset for the importance of opportunity and experiences. I think a lot of you who have been in that basic Charting the Life course training, where we have that opportunities lead to experiences, lead to more opportunities kind of cycle that we talk about, that we really need those higher expectations to create that mindset and move us closer to identifying and achieving those goals and dreams that we have. And let's face it, any dream we have is impacted by our health. So it includes all domains. In each case, healthy living touches on some of those social determinants of health and makes suggestion and gets people with disabilities and their families really thinking about how to support a positive trajectory for many of the things that we've talked about so far, that I've talked about so far. So let's take a peek. So when you look at this, the approach of the tool taps into the importance of understanding the why. We encourage people to why we encourage people to focus on using the framework and tools. So your why is that statement of purpose. It describes why you're doing what you're doing and how it supports your vision. It's your conviction, and knowing your conviction is one of the first steps to empowerment and self-determination. So many whys are mentioned here: managing and accessing healthcare, staying well, it's never too early, teaching healthy habits, getting plenty of physical activity, and creating a team of healthcare professionals that truly understand the person you're supporting. And that's at that very early stage. You're kind of teaching, often, at least I felt that way, your provider who you are as a family and who your child is and where your areas of concerns are. And I see, Connie, I see you taking pictures. You're going to get all of these. No, it's okay. It's good I saw it because I meant to mention it. Erica, as we talk, we'll be putting the links to these in the chat. So you do not have to be relying on my tiny words so that you're getting them. So she'll be putting it in the chat. She should be putting some of the quick guides or just the big blue book or the link so that you can find them on the website. So when you look at school age, why we're encouraged to think about school age, it's really that idea of developing skills and knowing how to make healthy choices, how to say no, taking a more active role in their own healthcare, in their own conversations with doctors, understanding their own health, and knowing their disability. Those of you that are here that are supporting older family members or older adults or even young adults, look at the earlier stages, see what's missing. Maybe we didn't do that. We need to re-engage and start talking about how to do it now, right? So looking at these across time is really powerful. Transition really looks at the importance of thinking about it as a part of transition, healthcare transition. I'll show you some great tools for that. Increasing their language and their knowledge about their own disability and health, beginning to allow them to take control of decisions and choices about their health. The more empowered I feel to be part of the conversation and be part of the decision making, the more I'm willing to learn and be part of that. So handing that over to them at whatever stage you are in ways that are meaningful and helping them do that is really powerful. I can say I've watched that from personal experience where whether I was ready to or not, I had to kind of let my daughter move forward, any one of my kids, move forward in their own healthcare. And but we've got a great relationship where communication and the ability to talk about it was a priority. And so therefore we are able to share a conversation about have you considered, and asking questions about their approach or their thoughts. And when we get into adulthood, we're really talking, there's more independence. So we're really talking about, you know, a lot of folks have moved in on their own, and they're in their own apartment, whether it's supported or not, so that good food choices and exercise may become an issue. How to manage your own medication. And there's so many ways to use technology for that, and support from assistive technology, smart homes, all that. And those, and just everyday technology, Alexa, things like that. So preventative and well care appointments, and letting them be active in those. And there's some great tools to help them talk about the appointment ahead of time, so they know their priorities when they walk in, and helping them be able to communicate to others how they're feeling, right? As we go into aging, who knows about them and can help them communicate their wants and needs besides us, right? We need a team of people that are informed, so they can continue to support when one of us, maybe a parent, is ill, or you know, a loss of a parent, or as a support professional, the person in that role changes. So we need to make sure we've got people who really truly understand them, and that we've got some paperwork and some we've used some of these tools so that can easily transfer from one person to the other. Really understanding how their disability impacts them as they age, and how in all of this, for both family members and the person with a disability, to maintain their emotional health as everybody walks through this aging process. So the Experience and Questions book, which is basically it's the quick guides all in one, is a larger book. It's a bit more comprehensive, and it really helps you see that integration of the framework across life stages. And in each life stage, it asks specific questions similar to those, and including those that are in the quick guides. It also asks questions that you should think about in every stage, and asks you, are you expressing concerns about your health or development, the child's health or development? Do you listen to your parent instincts when something just isn't right? Do you feel like you go along with every professional that tells you about your child, even when your gut tells you otherwise? And I think that's the beauty of this document, is it gives you the strength and maybe even the questions to ask yourself or others, so that even if your child's already transitioned into adulthood, or the people that you support are already young adults or adults, you can still go back to these and start thinking about them, and help the family think about them. If it's not your role, share these documents with the families that you're working with. So especially if they've had a healthcare change, and it helps regroup. A less known Charting a Life Course tool is the Exploring Decision-Making supports, where we look into those steps that helps grow someone's involvement and in their own decision-making, and making their life's choices in each domain. And it helps kind of map where they are now, and it lends itself to a conversation of where they want to be. And it can be used in so many different ways. It can be used as a simple assessment, like I said, of where you are, or it can lend itself to those conversations. It can be something that someone is an active participant in the decisions, and says, I want to move. I want to start talking about this. I want to start, that's something we've never talked about, because they saw the question on the document. And it just is a way to determine simple supports that can be provided, so that they can be more interdependent. I would never go into a major doctor's appointment if there was something new going on with me. Maybe there's a new diagnosis, without my husband there and saying, hey, what do you think? We all do that. And so helping them build those people in their lives, maybe thinking about maybe several different ones that could be in that position. And maybe there's one person that I take to a very specific doctor, and then my family member I might take to my general appointments. But when I'm doing something like a gynecological appointment, I might take someone else. And so it just varies from place to place and family to family. So a lot of you are familiar with the one page, but there is a specific one page for health. And this one offers specific questions about what you need and where you are and what's important to you in your own health. So asking someone to really engage in that conversation and share their thinking about their vision for their own health, it's a great tool to begin that conversation. I share with you, for those of you who's the folks that are supporting, if you ask these particular questions, you don't think it would go well. What are your skills and positive traits that help you stay healthy? You can think about that and think about, in terms of them, what would be the best way to approach this. There's a lot of different ways that we do this. Going to the people that know them best and say, if we wanted to get this information, how do you think we could do that? Whether that's a family member talking to a school team or to the other community sports, or those that are in those professional positions talking to families or other professionals that might be able to do that. Many of our the folks at FRNO have had this experience of talking to families, so you can always talk to any of us to brainstorm. But starting simple and moving into these questions is sometimes better too, and starting with the basic one pager and talking about just who you are and what's important to you, and then moving into some of these others. But even if it just taps into your head to say, oh, I should be having different conversations about health in general, makes these tools super powerful. Watching my time. Many of you are also familiar with the trajectory. Like other tools in Charting the Life course, maybe taking these tools and using them for yourself first can be very enlightening to how powerful they are and how they might work best with the person that you're supporting, or doing it alongside any and all of your family members to kind of get a gauge of where we all are. So it's not something special if you're a parent lead, but even if you are a professional, trying these yourself makes a big difference. And none of us are going to not benefit from asking ourselves questions like, what are the health issues that I'm most worried about? What's my vision around fitness? Are there any diagnoses that are specific concerns for me right now? How does my vision for health really take on my vision for life, right? And really evaluating what we've done before and how it impacts where we're moving forward. Looking at those things, whoops, I tried to scroll down on my screen. Looking at those things that we don't want in our life, if we're struggling with what we want, is always a great place to start. So those things stand no matter what in the Charting the Life course model. The Charting the Life course integrated support star is also something we can use in these conversations. There's one that just gives us ideas of what to think about. I am going to zoom in on this one because it is a little wonky. Hold on one second, just so you get a little bit better of a sense of it. Hold on one second. So when you look here, it's a little blurrier when I come in, but it talks about, do you communicate with your doctors and other medical professionals? Are you knowledgeable about your needs or your special healthcare needs? That's a question we could all ask ourselves. Any one of us run into issues of having a hard time saying what we really want to a doctor, or feeling as if they're truly hearing us, right? Knowing when to seek help for health issues, understanding changes as our body becomes an adult, or as in my case, as my body ages. I'm so confused by this process. So knowing who to ask, understanding the health risks associated with maybe some of the things that I participate in life, with smoking, with enjoying a drink here or there, with unprotected sex. These are all conversations that are important. Relationships and supports for healthy living, of course, your doctors and your nurses, but what family members, what people that are in your village help you think about these things and you would feel safe having a conversation with, and making sure you say, as a family member, who is that person for you? And it's okay that it's not me, but let's make sure it's a trusted person within the family. Things like that. Lots of technology, pill reminders, chats with nurses online. Telemedicine has really changed and made healthcare more accessible, especially mental health care. Exercise equipment, healthy fitness apps, a smart toothbrush that doesn't turn off until you've brushed long enough. I have one. I use it because I get tired and bored and want to move on to the next thing. So again, utilizing that star for really thinking about how we can better support ourselves and the folks that we support, and expanding our circles. I think it's really important for family members to expand your circle of who possibly can do this work with you. And that's a very brave, but a very intentional ask. But I think it's one in this domain that others will understand, probably with little explanation, that you need someone else to kind of know the answers to the important questions in case you can't be there to ask them and to participate. So it is a nice toe in the water in building that village of people that are going to support your child well beyond when we're not here anymore. So think about that. And this is a great tool to have that conversation. Let's see. So these are some newer tools that folks are not as aware of, but they can really support this kind of involving people and their families together to be looking through that lens of possibility and self-determination that really helps that locus of control be at the person with the disability that you're supporting, and allows them really participation and decision, but it's that that you're doing it together. And that's creating these healthcare team documents. I'm going to zoom a little bit so you can just get a gist of them. So really knowing who my team is, and so who's your personal support team? Where do you get more formal supports? Do you have paid staff? Do you have a residential provider or a provider agency? What other things are important in those formal supports that would come into play? Who has legal authority and understanding that, right? If I go down here, there we go, good. I was afraid it was going to take me out. What are those areas of support for medical appointments that I need? What do I need and who's can help me? And so it asks very specific questions. So just visiting these tools and taking a second to really think about them can be really powerful. It can change the way you're thinking. There's also one about the healthcare visit and just what medicines are you currently taking? What's bothering you right now? What do you need to think about a little bit more? Why am I even going to the doctor today? And, I think sometimes we're guilty of not even really having that in-depth conversation. We might tell them, oh, we're going to see the dentist, or, oh, we're going to see this doctor because of this, but we don't have that in-depth conversation that really helps and empowers them to be part of the conversation and understand more what's going on in the room. That information about the treatment plan so they can preemptively learn and know. We do it in education. We do that pre-teaching before the lesson, but let's think about it in this space because it can avoid some real concerns or trauma on the part of the person with a disability that we're supporting. So those are also beautiful tools. Hopefully Erica's putting those in the chat. This flyer is another one. And Erica, I've got that link in my thing because I knew I hadn't passed that on to you. So I'm going to put that in the chat. We have been working, I say I'm going to do that, but I don't know if
I have it. So you sent it to me.
Oh,
thank you.
Oh, good.
Yeah,
awesome.
now.
I'm smarter than I think. All right. So this particular one, the Ohio Department has worked very closely with a team of folks to create these transition resources into adult healthcare. And there's modules, there's books that you can go through and read what to expect. But these are some great tools and resources around healthcare transition. And they're accessible to anyone. and they're set up for families and primarily for the person to go through with whatever support they need. I wouldn't say if you've already transitioned to adulthood that you shouldn't go through these, because I think that everybody will learn something. I even learned some things. It's all in easy to read, plain language. There's videos of young adults showing you how you can be part of this. It's really been a thoughtful tool, and Erica put it in the chat. But take a peek at that. There's some amazing things in that, in those modules and the resources that are provided for them that can really, and those of you that are working with or family members of younger kids, go look at it. It is beautiful anticipatory guidance. You can never start this process of self-determination in your own care too early. So knowing what that looks like or what you want the end game to look like can really change how you work with your current doctors or pediatrician or specialist now. And that's really, really important to feel the confidence that you need to feel to do that. So let's think about this for a second. How can people support or how can you support folks in different stages across those life stages of charting a life course? So when you think about it down here, often we're in these earlier stages when we get a diagnosis. So healthcare professionals really knowing about you or knowing about the child really can support a family as they're trying to know what to do and respond in that space, and them doing it in an appropriate manner. Family members in the room and likely professionals. We've all heard those stories, very traumatic stories at birth of what might be said at birth when a disability is obvious during the birth process. And that carries with families for a really long time. So recognizing and talking to healthcare professionals in your roles, in your own appointments, with or without disability, so that we have healthcare professionals that are informed. That's another job of the USED. And we do that in a lot of different spaces, but that's really important. Connecting with other parents in that stage. Remember that peer and networking and support bucket is really important, and engaging you as professionals. They're really good about reminding parents about how important that is. Providing those spaces, school providing those spaces. I can remember one didn't exist in my child's elementary school, my daughter's elementary school, and we created it as a group of parents because we just knew how important it was that we talk to each other and support each other in that space. Making sure that your child has the ability and you give them permission to be their own advocate in these spaces and know how to interact respectfully with professionals, but be able to comfortably ask questions or say, I don't understand, or that doesn't make sense, or I don't want to do that, right? It still lends itself to those other conversations, but having within reason those opportunities that they can self-advocate and they can be heard is going to make them better later on in life in terms of advocating for their own health. Helping them understand insurance in whatever way they can, just that they know if someone asks, do you receive Medicare? Are you on Medicare? If they simply know yes or no to that question, it's really helpful and empowering. Understanding how employment impacts their healthcare and benefits. Simple statements that help them know and understand. Their siblings know, and helping them know and understand. And I say siblings because I recall when I got my first job and I was offered life insurance, and I made my sister, who was fully supported by the system, the beneficiary of my life insurance. And I never asked anybody. I just thought it was very altruistic of me to share this if I was gone, not understanding the impact that would have had on her life, nor what it might mean across time for any one of us, and the work that it would have required for my parents and all that. So knowing all of that is important, and talking about it as families. And then, that empowering them in their own decision-making practice is really, whether you have guardians, if there's families on the call, whether you have guardianship or not, supported decision-making can be part of that conversation, bringing them in and making sure their voice is heard, And the tools are such a great space for that. That one page, person-centered description, just the basic one, what's important to me and how can you best support me, and really working with your family member to have that for important spaces like doctor's offices, for their direct support, for their providers, things like that. It can be really powerful. It's important to me that if you see me doing this, you might understand I'm not feeling well, right? And making sure that that's shared. So there's lots of different ways that you can ask others to help along the way as you look at this trajectory. The exploring possibilities tool, you can really look to that for different ideas about how to move beyond traditional options and think about things in a more innovative space in that healthy living space. You're pushing to have a gym membership as opposed to a special needs class. Doing both. I think none of us can get too much exercise, but being able to, participate in all different things, going to health fairs that are just offered in your community. First of all, health fairs are fun because they give away great stuff. And at the same time, you get to talk to others who maybe heard differently about how I might care for my health. So just little ideas like that make it really simple. So throughout the person that, your family member's life, throughout the lives of the folks that you're supporting, the goal of the primary provider is to really advocate for their health and safety. So you really want to ensure that they understand that you see them and place high expectations on them, that they're a partner, because they can deliver all the necessary documentations or referrals for any of the things you need throughout education, your IEPs, your 504s, things like that, especially if you have 504 accommodations that involve their health. And this can occur during your annual and well child visits or in a different appointment, just depending. The process can be more complicated and time intensive if there's a newer diagnosis. Sometimes when you get the initial diagnosis of ADHD or a learning disability, and your child wasn't diagnosed at a younger age, you might need their input and their help to really guide you in your conversations with school about what's truly needed. And some of the assessments that they might be able to do or encourage the school to do to really get accurate input, not only from the medical provider, but from the teachers, the daycare providers, to get that perspective of the whole child, not just in school, but outside in the clinic and at home. And as a parent or someone who supports them or partners with someone with a disability in the healthcare setting, they have to have an important role in engaging the person so that they can grow their own skills in the process, engaging them in just conversations, including them and explaining what the doctor's saying. If the doctor doesn't do a great job of using plain language, model that for them. Ask them to repeat it in simpler language. Ask them what they mean, and then look at them and say, would you like to ask a question? Really helping them to know about their medications, keeping them informed when they have new appointments and specialists, and helping them see what you're doing with referrals, helping them track some of that, and really growing their vocabulary to support them in the healthcare process. I've never been more aware in 2024 of how when I have a level of understanding of vocabulary, I am treated different in the doctor's office. I'm not dismissed. There's more shared decision-making in the medical space when I have an understanding of their language, especially when it directly refers to me or applies to me. Let's see. Did my slide change there also? Let's see. Nope. There we go. Also recognizing that as we move into self-determination, it is important whether or not the provider is preferred by the person. It is also important that they have an expertise when we can get that. So balancing those two as family members, I recognize is important, but giving them a voice and ways that you can negotiate with them around an unpreferred provider, but that you feel as very strongly as a necessary provider. And again, having those conversations, encouraging understanding, giving them choices, pushing them and pushing yourself to allow for self-determination is really something that's going to impact them across the lifespan. Being knowledgeable about their disability and impact. My niece used to do a presentation, PowerPoint presentation. My niece has Down syndrome. She's now 25 and no longer in school, but every year she would present to her class and talk about what Down syndrome was, how it impacted her, where it was her superpower. And she did it at an age appropriate level across time so that the kids in her classroom, as she was included in regular ed, understood where her strengths were and, you know, where her challenges were. And so it's really kind of having them understand that, but also knowing what I refer to as their superpowers. All of us need to know our superpower, right? So looking at that and considering that as you move into this space of self-determination in the person you support's healthcare. So Charting the LifeCourse is a framework, and it's based on those 8 principles that we tapped into before. It was created to help people and their families of all abilities and all ages develop that vision for a good life and think about what they want and need and want and know to do, know and do, sorry, and find those supports they need. So I encourage you, if this is one of your earlier opportunities of learning about Charting the LifeCourse, I encourage you to go to our website or go to the website lifecoursetools.com and look around and learn more about the principles or different ways that you can learn more there. But also we have a fabulous website that is just growing and growing at Family Resource Network of Ohio. Erica has done a great job of creating a video library. So if there's one tool that you really liked, maybe it's the one page, there'll be a 1 hour on the one page and how you can really utilize that. There'll be a 3-hour general Charting the LifeCourse if you want to revisit that. But there's great ways and tools to take a peek at that space. So I highly encourage it. As I said before, Ohio's support in this space is growing. We're seeing so many fabulous things happen. And I'm really excited about the investment and prioritization